Okay, so I guess I'm up. Thank you for everyone who's here joining us tonight for this presentation. I am going to start the talk today with talking about prediabetes and preventing, delaying the progression to diabetes. And then going to be followed by Mindy, who's going to give us just some in detailed information regarding diet and preventing prediabetes as well as diabetes. So for my talk, I am going to just do an overview, give some background information regarding some statistics on diabetes and prediabetes, just go over definitions of what we consider prediabetes as well as diabetes, how we diagnose it, and then talk about prevention at the end. So just as far as, just before I continue, I just want to see, does everyone see my box as well as the?
Yeah, we can see your presentation as well.
Okay, do you see the box with my picture and everything? So I'll take that away.
Yes.
Okay, I'm going to just move that out of the way then. Okay. Okay, so just going over the scope of diabetes. So approximately 34 million Americans have diabetes, and about 20% of people who have diabetes do not know it. And we project that as many as 1 in 3 Americans in 2050 will have diabetes unless we take steps to prevent diabetes. As far as prediabetes, there's about 86 million people in the country that have prediabetes. So this is about 1 out of every 3 Americans that have prediabetes. And just like diabetes, that there's a fair share of people who don't know it, that's also the case for prediabetes, but there's even larger number. So 9 out of 10, so 90% of people who have prediabetes don't even know that they have prediabetes. So we're talking about a huge population that have diabetes or prediabetes. About a third of every American has some form of prediabetes or diabetes. So again, just to talk about what is prediabetes versus diabetes. We'll talk about prediabetes in a second, but just a brief overview of diabetes. There's basically 2 main categories that most people are familiar with. We'll talk about them a little bit in detail. One is type 1 diabetes and the other is type 2 diabetes. So as the name suggests, prediabetes comes before type 2 diabetes. The good thing about it is that prediabetes does not have to progress to diabetes. So when someone has prediabetes, there are steps that we can take to actually reverse it. So blood glucose are higher than normal, but they do not yet have diabetes. And we'll talk about those specific numbers in a few. And then again, there's so many people who have prediabetes and have no idea. So if you have prediabetes, what does it mean? Why do we get concerned about prediabetes? Why do we get concerned about diabetes? It's not just because sugar is high in the blood that is a concern. It's because of what the sugar elevations can affect. And basically, glucose elevations can affect every organ in our body. And so we want to try to maintain normal glucose so that this does not occur. So if you have prediabetes, it may lead to diabetes sometime in the future. And even just with prediabetes, you're at a higher risk of developing heart disease or stroke and some other what we call microvascular complications, which could be problems with the eyes, as well as the kidneys and the nerves in your body. So when we think of type 1 types of diabetes, again, we talk about type 1 and type 2. There are some other forms of diabetes that I'm not going to go into today, but these are the 2 main categories. Type 1 diabetes, we typically think of these as younger individuals, so children that are diagnosed or young adults. They tend to be thin. And basically with type 1 diabetes, there's no insulin production in the body at all. And so because of that, insulin is life-sustaining. Without insulin, these people that are affected would pass away relatively quickly if their bodies did not have insulin. Whereas type 2 diabetes is the most common form of diabetes, and this type of diabetes is most often diagnosed in adults. But as we have seen more and more children develop obesity, we're starting to see this even in younger children as well. So just to talk a little bit about the physiology of diabetes and what different organs, hormones are involved. One is insulin. So insulin is produced by the pancreas. It's released by the pancreas and goes into the bloodstream. The other part when we talk about diabetes is the glucose. So glucose or sugar is basically the nutrient that is in our foods that we consider carbs or starches. And it's basically what carbs and starches are broken down to in the gut and intestines that then gets absorbed into the bloodstream and should go into the cells. Pancreas is the organ that produces insulin. It's located behind the stomach. And again, one of its functions is to produce insulin. So insulin is the key factor. It basically allows sugar to enter the different cells in our body. So these are muscle cells, liver, fat, and other organs. And then that allows those organs to use the glucose for energy. So this is just a picture, illustration of basically our stomach, which is the big organ here in the center, our esophagus, we eat food, the carbs, starches start to be broken down in the stomach into glucose, that then once it gets into the pancreas gets absorbed into, I'm sorry, not the pancreas, into the small intestines, gets absorbed into the bloodstream. And then we have our pancreas, which sits again behind the stomach, that's producing insulin. It releases insulin, and that also goes into the bloodstream. And then the insulin is basically able to diffuse out into the body to go to cells that then will allow the glucose to be taken up by those cells. And again, our cells need that glucose in order to function normally. So just to talk about the difference between type 1 versus type 2 diabetes, to show the first diagram, this is a healthy pancreas and healthy insulin sensitivity, healthy receptors. So again, this is a diagram of the pancreas, and the pancreas is releasing insulin. There's glucose in the bloodstream, and this is a cell. On this cell is a receptor for insulin, and then there's also a channel that allows glucose to enter the cell. And so what normally would happen is that insulin released from the pancreas attaches to this receptor that then signals this channel to open, and then glucose enters into the cell. So what happens in type 1 diabetes? So for type 1 diabetes, the issue is right here with the pancreas. The pancreas, through autoimmune destruction, is no longer to produce insulin at all. And so basically, there's no insulin there. There's no insulin to bind to the receptor. Their channel can't open, and glucose just sits outside of the body. And so these people absolutely need insulin in order to open up that channel and to let the glucose in. Again, if they don't have the insulin, glucose can't get in, and it is immediately can be fatal. This is different than type 2 diabetes, where basically the pancreas actually, especially initially, is able to produce a lot of insulin. The issue is actually right here at the receptor. So this receptor has resistance to the insulin. So that although insulin is here and it's actually here in a large quantity, the receptor just doesn't respond. And so because of that, the channel opens, but it's a little bit tight. So the glucose is not able to get in as freely. And then you have elevations in the glucose outside of the cell. So again, the main difference is that with type 1 diabetes, there's no insulin production. In type 2 diabetes, especially initially earlier on in the course of the disease, there's actually a lot of insulin being produced because there's resistance at the receptor. So cells in the body, again, can develop resistance to the insulin. And because of that, the glucose just can't flow into the cells, and it just stays elevated in the blood. And so that's why when we monitor our sugar, we'll see that, instead of a normal glucose of under 100, we may see some people have sugars up in the 200s. And that's because, again, there's resistance to the insulin and the glucose just can't move into the cell. Again, the pancreas goes into overdrive. So the pancreas realizes that there's not enough, that the glucose is not getting into the cells. And so it just starts churning out more and more insulin. And the insulin levels can go up to 5 to 7 times normal to try to get the glucose into the cells. So this is something that happens, is what's happening in prediabetes. And initially with prediabetes, the pancreas is able to produce enough insulin to keep the glucose levels normal. But over time, the resistance gets to be more and more, and the pancreas just is not able to overcome that resistance. And then the sugars start to rise to higher levels. So this is a busy slide, but the main point to say is that it creates a vicious cycle. So basically cells that need glucose become starved of energy while the glucose is in the bloodstream stays elevated because there's no place for it to go. This then signals back to the pancreas to produce more insulin. And then the pancreas ends up storing, because of these higher levels of insulin, the body starts to store fat, especially in our abdominal area. This fat in the abdominal area then causes inflammation in the liver becomes inflamed, and then basically causes more insulin resistance. So then you get to a chicken and egg situation where you have insulin resistance that causes belly fat to accumulate that then causes more insulin resistance. So we basically need to do things that stop this vicious cycle. So this is just another diagram illustration of, when we talk about insulin resistance. So definitely someone who has a high carb diet, there's a lot of carbs that are going to get turned into sugar. It's going to cause the pancreas to need to produce and release more insulin. If there's not enough insulin there because of the resistance on the cells, the glucose in the blood are going to go up. And because it's not getting to the cells, you're going to feel hungry and then going to go back to, potentially eating more carbs. So again, we want to break this cycle because it can just continue to lead to more weight gain, more insulin resistance, and higher glucose levels. So again, as we discussed earlier, the reason why we want to prevent the sugars from rising is because it does, even with prediabetes, before we get to diabetes, people who have prediabetes are at a higher risk of heart disease and stroke. However, they don't yet have to manage the serious health problems that come with diabetes. So once someone develops diabetes, then there's other things that we get concerned about regarding, more likelihood developing these cardiovascular complications, more tight blood pressure goals, tighter cholesterol goals. You're seeing an eye doctor because we want to make sure that the diabetes is not affecting the eyes, checking blood work more frequently because we want to keep an eye on the kidneys and protein in the urine. So it is that prediabetes, if we know that someone has it, if that we have prediabetes, we want to get on top of it quickly because we can, again, reverse prediabetes and try to prevent some of these more serious complications associated with progressing into diabetes. And again, diabetes can affect every major organ in the body. So this is just a graph just showing some of the potential complications of diabetes. So again, because it can affect every organ system, we can have things like stroke, can have damage to the eyes that can lead to loss of vision, have heart attack, of course, damage to the kidneys, which can lead to renal failure and requiring hemodialysis. It can have effect on sexual function, causing erectile dysfunction. Also can cause problems with this circulation in the extremities, causing neuropathy, which is basically the glucose affecting the nerves that can lead to tingling, burning, numbness, loss of sensation. And that combination of decreased blood flow and the decreased sensation can lead to ulcers that could eventually lead to amputations. So these are all things that can be associated with diabetes. So one, we're going to try to prevent diabetes, and two, if someone has diabetes, we want to try to get the sugars as tightly controlled as possible to prevent these types of complications. Some of the things that we don't necessarily always think about diabetes is that just mental health. Depression is extremely common in diabetes. Some studies suggest that diabetes doubles the risk of depression. And then risk increases as more diabetes-related health problems develop. So again, we talk about someone having diabetes, but what if someone develops end-stage renal disease and has to go on dialysis, or they have a foot ulcer that's not healing? All of these things, build up and, can cause someone to feel depressed because of their health situation. So what are the risk factors for developing prediabetes, diabetes? One is definitely being overweight, because again, we talk about the insulin resistance that is the basically cornerstone of developing prediabetes. The older we are, the more likely. So the age of 45 seems to be a point in our lives that the risk of prediabetes starts to increase. If you have a family history, so you have a mother, father, a sibling with type 2 diabetes, that's also going to increase your risk. Not being active, so someone who's sedentary versus someone who goes out and exercises several times a week, they're going to be at a higher risk of developing prediabetes. Women who have had a history of gestational diabetes, which is basically diabetes that was diagnosed just during pregnancy, they're at a higher risk. And also if the baby weighed more than 9 pounds at birth, that also is a higher risk for developing diabetes. And then some racial and ethnic groups have a higher risk: African Americans, Hispanic Latino, American Indian, Pacific Islander, and some Asian Americans are at higher risk. So what are some of the symptoms that we should look out for prediabetes? And unfortunately, there's not, most of the time there aren't any symptoms. And that's part of the reason why there is a large number of people who have prediabetes and they're undiagnosed. And so we really have to pay attention to screening for prediabetes. So if someone has those risk factors that we talked about before, so any of these risk factors, we want to make sure that those people are being appropriately screened at least annually for prediabetes. One possible sign of prediabetes is something called acanthosis nigricans, which is a darkening of the skin in certain areas of the body. This typically is on the necks, under the arms, the elbows, knees, and knuckles. I have a picture that I'll show in a second of that. Signs and symptoms of diabetes, these are more common, especially when someone's sugars are elevated in the 200s or higher, that could feel thirsty, frequent urination, excessive hunger, fatigue, blurred vision, a higher chance of having infections. So sometimes people first find out that they have diabetes after they've had a urinary tract infection or a wound that just won't heal. So this is a picture of, again, we call it a velvety rash. It's called acanthosis nigricans that we often see on the back of the neck. So again, it's like this velvety rash. Sometimes people think like, oh, their skin isn't clean, and it's not. The skin is perfectly clean. It's just that this rash develops, and it's a sign of insulin resistance. And again, we can see it in the underarm area as well as on the knees and the elbows. So again, going back to, who should we screen? So 45 is generally the kind of screening criteria that we start with. So under age 45, but someone who's overweight and has an increased risk for diabetes, so again, has some of those other risk factors, one or more of those other risk factors, we're going to screen them. If you're age 45 or older and overweight, then baseline should be screened. So anyone 45 or older should be having a annual a glucose test just to make sure that the glucose is normal. And then again, also someone's overweight, regardless of age, should be considering screening. So age 45 or older and not overweight, ask your doctor. Actually, I guess I said that a little bit wrong. So age 45 and older and overweight should be screened. If you're age 45 or older and not overweight, don't have any of the other risk factors, then it's something to have a discussion with your doctor. So what can we do, or how do we screen for prediabetes and diabetes? So we can check just the fasting glucose, which again would be just a, when generally you're getting routine blood work, one of the tests is something called a basic metabolic panel or a comprehensive metabolic panel. And on that will have the glucose. And if you fast, and typically fasting is 8 hours. So fasting for 8 hours, we check the glucose. If it's elevated in certain levels, which we'll go over in a second, then that could be diagnostic of prediabetes or diabetes. Hemoglobin A1C is another test that we have. That is basically everyone's red blood cells carry a protein called hemoglobin. That hemoglobin is what carries around oxygen to our body. And hemoglobin has a lifespan of about 3 months. And everyone's hemoglobin binds glucose. And so when the glucose levels are normal, there's a certain amount of glucose that's bound to that hemoglobin. When the sugars start to rise, the amount of glucose bound to the hemoglobin rises. And so that's why we can use that number to kind of give us a 3-month average of someone's sugar. And so again, because the lifespan of a hemoglobin is about 3 months, that's why we say it's about a 3-month average of the sugar. And then the last test that I'll talk about is something called an oral glucose tolerance test. And women who've had children may be familiar with this because we do a similar test during pregnancy, where you basically drink a glucose drink, and then we check the sugar before, and then 1, 2, 3 hours afterwards to see what the glucose levels are. So when we look at fasting glucose, we're looking at, again, at least 8 hours since last had anything by mouth except for water. And then if the fasting blood glucose is greater than 126 or greater, then that is diagnostic of diabetes. And generally we need to have at least 2 readings of greater than 126. So we're not going to diagnose it based on just one glucose. In the past, they said it should be separated by a couple of weeks. Now they said that it should be done actually as soon as possible. So if 2 glucose readings are greater than 126 or 126 or greater, that's diagnostic of diabetes. And then prediabetes is diagnosed when the glucose is between 100 and 125. So again, hemoglobin A1C reflects the average blood sugar level over the last 2 to 3 months. It measures again what the percentage of your hemoglobin is coated with sugar. And so the higher the A1C level, the poorer the blood sugar control. So most labs, a normal range is going to be an A1C of under 5.7. And then for prediabetes, 5.7 to 6.4. And in diabetes, 6.5 and higher. There are some situations where these numbers are not accurate, and that's something that sometimes we have to discuss, but these are the general ranges for normal prediabetes and diabetes. So we can look at A1C and we can say what the average, we can estimate what the average glucose is. So these are all A1Cs that are abnormal. So starting at 6, which again would be in that pre-diabetic range. So someone has an A1C of 6, say that they were actually already diagnosed with diabetes and they're able to get their A1C down to 6, which is a great number. We typically want to try to get the A1C under 7, and under 6.5 is even better. So someone who has an A1C of 6, excuse me, has an average estimated glucose of about 126, versus someone whose A1C is about 10 their average glucose is 240. So we can see that that is, a very high number. The last test is, again, an oral glucose tolerance test. There is different, you could do 2 hour, 3 hour. I give information here for a 2 hour test. So again, the sugar is checked fasting. Then we have the 75-gram glucose, which is quite a bit of sugar. And then after the person has the glucose, we check their sugar 1 and 2 hours later. So these are the 2 hour readings that we're looking at here. So if the glucose is under 140, 2 hours after taking that sweet drink, then that is normal. If it's between 140 and 199, that is in the prediabetes range. And if it's over 200 or greater, it is in the diabetic range or diabetes range. As you could imagine, these are not hard points. So, we can't say that someone whose glucose is 139 is normal and 140 is abnormal or prediabetes. So this is a continuum. So if you're having numbers that are close to the next range, it just, kind of says that you're further along the progression and just making more important to try to get the numbers back down into the normal range. And this is just a quick diagram, just kind of going over the different tests that we talked about, the A1C, the fasting glucose, the glucose tolerance, and what the normal ranges are versus the prediabetes versus the diabetes. And this, again, if people are getting the slides, you'll have this information. So again, what can we do to prevent diabetes? And we like to look at this diagram. I like to show this diagram and thinking about prediabetes as being the fork in the road. So, you're here with prediabetes. Are we going to go to the right, which is leading towards diabetes, or are we going to go to the left, which is going back to a normal range? And you change your right and left however you would like. But, what we want to do is try to get back into a normal range. So if you ignore it, you know that you have prediabetes and you don't do anything, make lifestyle changes to try to get the numbers back to normal, then your risk for diabetes is going to go up. And so we know that there's basic lifestyle changes that we can make that really can reduce our risk of developing diabetes if we have prediabetes dramatically. And these, include things like changes in diet, increasing physical activity, and losing weight. And again, one of the things that I definitely just want to kind of really discuss is that at this point, we really feel that prediabetes is reversible, but that diabetes is not. So once someone develops diabetes, there's been enough decline in the pancreas's ability to produce insulin because of loss of what's called beta cells that produce insulin that's not reversible. So we don't have anything to reverse someone from diabetes to go back to normal. But that's not the case with prediabetes. There has not been, our general thought is that there has not been a loss of those beta cells that produce insulin. And so just by improving the insulin resistance, we can get the sugars back to normal. So I just wanted to throw this slide in because we're not really talking about the other risk factors when we talk about cardiovascular disease, which diabetes, of course, is one. But we also like to talk about the ABCs for cardiovascular disease. So that's A1C, which is our glucose. The B is for blood pressure, and the C is for cholesterol. These are just general goals. Again, it can vary based on someone's medical history, but generally we like to see a blood pressure under 130/80, and our cholesterol, the LDL or the lousy cholesterol, under 100, maybe even a little bit lower, under 70, if someone has had a history of heart disease or has a high cardiovascular risk. The HDL or the happy cholesterol. So this is a cholesterol we want to be as high as possible. We want it to be at least greater than 40 for men and and greater than 50 for women. And then triglycerides are the actual fat in our blood. We want that to be under 150. And following a low-fat diet has an impact on all of these. So prevention, delay or prevent type 2 diabetes. And again, this goes along with reversing prediabetes, eating healthier, regular physical activity, and weight loss. I'm going to leave most of the meal planning diet to Mindy, who's going to give a great talk after me. But one of the things that you can do is work with a dietitian to individualize or personalize your own meal plan, so that if you're someone that's overweight, to help you lose weight, try to help you incorporate more lean protein and healthy fats into your diet, increasing your fiber through fruits and vegetables, and limiting processed foods, including products with refined grains and added sugars. This is my quick and dirty way in the office of, trying to quickly go over meal planning for a lot of my patients, which is you think of your plate and cut that plate into a half, and then another half, and then one of the halves you cut into a quarter. So the one half of the plate is your vegetables and salad. So often we see that people are piling on the starch, and then there's a small amount of vegetable or salad, and we want that to be the opposite. So half of our plate is vegetable and salad. A quarter of the plate is our lean protein, so things like skinless chicken, fish, lean cuts of beef, but that still should be limited to no more than once a week, or lean cuts of pork limited to once a week. And then our starch is just a quarter of our plate. And I'm sure Mindy's going to talk about healthier starches that we can add to our diet that are better than things like white rice or white pasta, white breads. Water is our favorite form of hydration, getting away from any juices and any sodas. And then again, incorporating fruit into our diet as well. We just have to be careful with the portions and quantities, and some fruits are better than others. And Mindy, again, may talk about that a little bit. So let's talk about exercise. So the diabetes prevention program study showed that 30 minutes a day of moderate physical activity, along with a 5 to 10% weight loss, produced a 58% reduction in diabetes. So we know that, again, a small amount of activity, 30 minutes a day, 5 to 10% weight loss. A lot of times people feel like, okay, I need to lose 50 pounds. And we really shouldn't think about it in that way when we're talking about improving our overall health, our cardiovascular health, reducing these risk factors. Because a lot of times when we think of those huge numbers, it can be discouraging and easy for someone not to start because they feel like they have so much to lose. So if you think about 5 to 10% weight loss, those numbers are generally much more manageable and more likely to lose. And again, it's going to have a huge benefit on reducing cardiovascular risk. So again, a little bit goes a long way when we're talking about exercise. We are talking about specific, exercise, but then also just being more active throughout the day. So, working in the garden, playing with the kids, taking the stairs when you're at work, parking further away from the entrance so that you're walking more. Walking is a great form of exercise. It tends, to be something that most of us have access to. It's low impact, and actually is a great form of exercise. So trying again to work up to at least 30 minutes of walking on most days. Basically 150 minutes of aerobic exercise is recommended per week. And sometimes, again, it can be daunting to think about even, getting 30 minutes altogether. So splitting to 2 15-minute blocks or 3 10-minute blocks is, something to try to think about if doing 30 minutes at one time is not feasible. And also you can maybe just start again, like at 10 minutes and then work your way up from there. Incorporating strength training is very important important. A lot of times people are doing the aerobic activity, but they're just not getting any of the strength training in. And we know that strength training is important because it's increasing muscle mass. Muscle mass is what's the metabolically active tissue in our body, much more so than fat. And so when we build muscle, we're improving our metabolism. So in addition to exercise, and actually probably more important to exercise, because if you think about it, typically if somebody walks a mile, they're going to maybe burn about 100 calories. And walking a mile takes, most people probably anywhere between 15 to 20 minutes to walk a mile. But we can eat 100 calories in a matter of seconds. So although exercise is very important, it's important for cardiovascular health, reducing cardiovascular disease. As far as weight loss, we get the most of our weight loss through what we're eating. So cutting back on our overall calories, cutting back on high-fat foods is going to be extremely important. Again, being active most days of the week. Some people find it very helpful to keep records of their intake of food, also keeping a record of how much physical activity they're doing and what their weight is. So logging these things can sometimes help people stay on track. So just to talk about weight loss. So we said that, 5 to 10%. So just everyone think about how much you weigh. If you're overweight, what is 5 to 10% weight loss? If you're at a normal weight or a healthy weight, then, you don't want to lose more weight. But if you know that you're overweight, think about how much you weigh and what is 5 to 10%. So someone who weighs 150 pounds, that's 8 to 15 pounds. Someone that's 200 pounds, 10 to 20. So, we're talking about, not huge amounts of weight in order to have, again, a great effect on reducing your chance of progressing to prediabetes or diabetes. So I'm going to be wrapping up in a little bit. I do often get questions about supplements, so I did just want to go over just supplements. By far, again, the best way to manage diabetes, to try to prevent progression to diabetes, to try to reverse prediabetes, avoid getting prediabetes, is going to be lifestyle. So diet, exercise, maintaining a healthy weight. That's the tried and true way that we know we can do this. It's not easy by any stretch of imagination. I'm not going to fool anyone into thinking that, but that is definitely by far the best way to manage. But often get asked about supplements, just as far as there anything that, can help me achieve those goals. So just wanted to talk about that a little bit today, some of the common supplements. Some dietary supplements may have side effects, and some of these side effects, such as kidney damage, can be serious. So you always have to think about that when, you're seeing a commercial, a friend recommends a dietary supplement, that you should always, discuss these with your provider before starting any supplement. So the U.S. Food and Drug Administration is warning consumers about products that claim to be a natural diabetes cure or to replace your diabetes medication. There's basically no such thing. So these medications are marketed illegally. They sometimes are harmful. They can be harmful if people use them in place of their diabetes medication. So again, it's very important not to replace medical treatment for diabetes with an unproven health product or practice. Bottom line with supplements, and again, I have quite a few slides. I'm going to kind of go through them quickly. But the bottom line with all supplements is that many studies have investigated dietary supplements for preventing or treating type 2 diabetes or prediabetes. I kind of lost that part of my slide. Sorry about that. But there is not convincing evidence for most, if not all, of these supplements. So what do we know about the effectiveness of dietary supplements? For a few, there is weak evidence of a possible benefit. So chromium is one of those, which might help with blood sugar control. And alpha lipoic acid may be helpful for people who have diabetic neuropathy. For most supplements, however, there isn't evidence to support a beneficial effect on diabetes or its complications. So a lot of times, you know, you're potentially just wasting money. Herbal supplements, there's no reliable evidence that any of the herbal supplements can help to control diabetes or its complications. So we've heard about bitter melon, fenugreek, ginseng, milk thistle. So just not evidence that these are in controlled studies helpful in controlling diabetes or preventing complications related to diabetes. And then there are some supplements that actually can have again, a detrimental effect or unwanted side effects. There are no clear benefits of cinnamon for people with diabetes. Cassia cinnamon contains a chemical called coumarin, and for some people, taking large amounts of cassia cinnamon might worsen liver disease. So again, always contact your primary care doctor, your primary care provider, your endocrinologist, whoever you're working with, before starting supplements to discuss these kind of potential adverse effects. Vitamin C in general have not shown to improve blood sugar control or other conditions in people with diabetes. Vitamin D, if the levels are low, there is an associated increased risk of developing metabolic disorders such as type 2 diabetes or metabolic syndrome, insulin resistance. However, taking vitamin D doesn't appear to help prevent diabetes or improve blood sugar control for adults who have normal glucose levels. Taking too much vitamin D can actually cause elevations in your calcium and can be associated with things like nausea, constipation, kidney problems as well. So again, discussing these type of supplements with your provider before starting them. Magnesium is found in many foods. It's central to our body's ability to process glucose. Magnesium deficiency may increase the risk of developing diabetes. However, numerous studies generally show small. However, numerous studies that are out there are small, and the results are generally inconclusive. But if someone has magnesium deficiency, you do want to replace their magnesium. Large doses of magnesium can be associated with diarrhea and abdominal cramping, and very large doses can be deadly. Selenium, there was a review of 4 studies that involved about 20,000 participants that did not see that taking selenium reduced the likelihood of developing type 2 diabetes. And again, selenium can cause some side effects like hair or nail loss, GI symptoms, and nervous system abnormalities. So I am going to just finish up my talk by summarizing that one, prediabetes is reversible. It's associated with increased risk of heart disease and stroke. So that's why we do, in addition to avoiding progression to diabetes in and of itself can be associated with cardiovascular disease. So we want to try to get the numbers back to a normal range. If you are overweight, 5 to 10% weight loss. So a generally smaller weight loss and trying to get back to your 20-year-old weight is going to be helpful in reducing cardiovascular risk. Goal is 150 minutes a week of moderate physical activity. Of course, always get approval from your primary care doctor, provider, cardiologist before starting any kind of exercise routine. You want to make sure that your heart is healthy. There's no other conditions that's going to make it dangerous for you to exercise. But the goal would be 150 minutes, starting slow and working up to that 150 minutes. Mindy's going to be talking in a few minutes about our diet, but kind of just a quick and dirty way is to think about that plate method for meal planning. You want to increase your fiber in your diet, have lean proteins, and limit the processed foods, added sugar. And the last point I would say is to know your ABCs. So, what is your A1C? What is your blood pressure? What is your cholesterol? These are the 3 cardiovascular risks in addition to smoking cessation, being physically active, that are going to be determinants of developing cardiovascular disease. So you should know those numbers. Talk to your provider about those numbers. And if they're elevated, see what you can do in terms of diet and exercise to get them down to normal range. And with that, I would say thank you for sticking around. I'm going to stop sharing my screen. I'm not sure if we want to do questions now or at the end.
We're going to do questions at the end. We're going to let Mindy do her presentation first.
Okay.
Well, thank you, Dr. Gillis, for that great lead into my part of the presentation. I am going to discuss lifestyle strategies, including meal planning and physical activity. And I'm very glad that you could all join us tonight during National Diabetes Month. November is National Diabetes Month. And this year's theme is Small Steps, Big Difference. Preventing diabetes is within your reach. And I really love that theme because I feel that most people are successful when they make small changes to their eating or activity plan. The goal is not to become overwhelmed, which I know is easy to do. So we're going to try to break it down and make it a little bit easier for you. So as far as my objectives, by the end of my presentation, you'll be able to describe the relationship of food and blood glucose. You'll be able to discuss or know the different meal planning strategies and different ways you can increase your physical activity into your day. And first, I would like to say, because I really believe that it's true, the way that someone that has diabetes or prediabetes should eat really is the way everyone should aim to eat. Don't think of it as a diet. Let's think of it in terms of healthy habits. When I hear the word diet, I think negative, restriction, and then it ends up being temporary. And the same goes for physical activity. I think it's so important to focus on the positive, especially during these stressful times. Making healthy lifestyle changes can make a difference. As Dr. Gillis just talked about, you can prevent or delay the onset of type 2 diabetes. You may even be able to reverse prediabetes. And if you have diabetes, you can manage it so that you don't develop the complications that were previously discussed. So as I go through my presentation, try to come up with 1 or 2 goals that you would like to work on. Keep it small steps. The nutrition recommendations that we're going to discuss shortly will make more sense if you understand what happens when we eat. There are 3 main nutrients in food: carbohydrate, protein, and fat. They provide fuel for your body. Most foods contain a combination of these nutrients. And you may already know, from the previous presentation, that it's the carbohydrate part of food that raises your blood glucose level the most. So let's talk about that relationship of food and blood glucose a little bit more. We know that carbohydrates, or carbs for short, get broken down into sugars by the digestive system. Glucose is the type of sugar that your body uses for energy. These sugars then enter the bloodstream. And when you have diabetes, eating too much carbohydrate can raise your blood glucose too high. And we use the terms blood sugar and blood glucose interchangeably. Dr. Gillis also used this slide, excuse me, because it's a great slide that really just shows what happens. And I'm just going to do a real quick review because it'll really tie in with what we're going to talk about. When you eat, right, you chew, you swallow the food, it goes down your esophagus. You can see the tail end of your esophagus. Let me put on my little laser pointer. So it goes down your esophagus and into your stomach, where it's digested into smaller nutrients. The carbs are broken down into a form of sugar called glucose, and that's represented by these blue dots. The glucose is then absorbed through your digestive system and into your bloodstream. Then again, it's your pancreas, this weird shaped organ that sits behind your stomach, that releases the hormone insulin, and that's represented by those yellow dots. And the insulin assists in transferring the glucose from the blood to the cells of your body to give you energy. And when people develop diabetes, excuse me, their pancreas is either not making enough insulin or their body does not respond to the insulin they are making properly. As we just talked about, that's insulin resistance. Now, many foods contain carbs. Okay, and many of these foods that contain carbs are healthy foods and provide your body with important nutrients. Many of these foods provide vitamins, minerals, and fiber. And the fiber in foods helps slow down the release of sugar into your bloodstream. So these foods include grains such as your bread, cereal, pasta, rice, your starchy vegetables such as potatoes, sweet green peas, corn, and my favorite winter squash is butternut and acorn squash. Also dried beans and lentils. Some foods contain natural sugars such as fruit, juice, and dairy products. Once carbs are digested, they're all broken down into sugar. Okay, here's some more carbs. These are what we call the simple carbs, and they include foods with lots of added sugar. These foods include things like your cakes, cookies, pastries, donuts, candy, soda, the sugar we add to our foods, such as in our coffee or tea, or maple syrup we might add to pancakes or French toast. These foods really don't provide our body with much nutrition. There aren't many vitamins, minerals, or fiber in these foods. And simple carbs are digested more quickly, so they may cause a more rapid increase in your blood sugar level. But I have a question for you. Why do we eat these foods? Unfortunately, I can't hear your response, but I'm sure at least some or all of you responded in your head or out loud, they taste good, right? They do, they taste good, and they're often quick and easy foods to eat as well. Something for you to think about. What happens when you're told not to eat something? We often want them more. So, So really the goal that I want you to focus on is including more nutritious carbs and to focus on portion sizes, okay? Which leads to our next topic, how much you eat. And I always say what I teach is not rocket science. It's more about making the connections of how we eat and how it may affect your body. So you can come up with strategies to help you reach your goals. So I want you to think about this large plate of pasta. What is likely to happen to your blood glucose after eating this plate of pasta? It's likely to rise, right? Eating too much can also lead to weight gain, and we just learned too that weight gain often contributes to developing insulin resistance. Another question for you to think about. Do you sometimes eat too much? How do you know when you've eaten too much? Most people describe it feeling stuffed, bloated, tired, want to take a nap after you eat a large meal. It's usually not a good feeling. However, it is easy for us to eat too much. So let's discuss why it's so easy to overeat. Our stomach, when it's empty, really is only about the size of your fist. It really doesn't take a lot of food to make you feel full and satisfied. However, it takes about 20 minutes for your stomach to tell your brain that you're full. And 20 minutes is really, it's a long time. Let's think about a good example on this slide. Okay, think about how long it takes you to eat a slice of pizza. Maybe a few minutes, say it even takes you 5 minutes. When you're done eating the slice, you will likely still feel hungry. Plus it tastes good, so you go for another slice. And then maybe 10 minutes goes by and you still feel hungry and may want more. 20 minutes is a long time, so it's easy to eat more than our bodies really need because we live in the moment. You actually will feel full if you eat a smaller amount. It just takes a while for your stomach to send that signal to your brain that you're full. You might even realize that you actually feel better when you eat a little less. I know I do. So it might be something to experiment with. I always think of it as little experiments and try it out and see how it feels. So let's talk about some tips for eating smaller portions. First, just seems obvious, right? Put less food on your plate, just a little less at a time, especially maybe of those carb or other high calorie or high fat foods. Put a little less on your plate. You might even try drinking a glass of water before meals. It'll just help fill the space in your stomach so you won't get that feeling, or so that you will get that feeling of fullness before you overeat. It might help to eat a salad before your meal or even with your meal. Eat slowly. And it's really, you have to retrain this. You have to retrain yourself. This doesn't always come naturally to us, but get in the habit of putting your fork down between bites, take sips of your water between bites, really look at the food, smell it, taste it, really enjoy what you're eating. And sometimes I think really we eat so quickly we hardly even taste the food. I heard something interesting lately, right? There's no taste buds in your stomach. They're all in your mouth. right? To take smaller bites and savor every bite. It's even better for digestion to chew food thoroughly. Using a smaller plate actually has really been shown to help people eat smaller portions. And partly it's because it just appears like more food when it's on a smaller plate. Also, when people use a larger plate, I think we tend to put more food on it just to fill up the space. And really multiple studies have shown that people consume less when they eat on a smaller plate. So you might want to give that a try. Smaller bowls too. Think about cereal bowls. They're often very large. Okay. Also, put food on the plates in the kitchen. That might really help you to avoid going back for seconds. When it's on the table, it's just so easy to reach over and grab more food. And if you still tend to go back for more food, you may want to consider putting the extra food into containers before you sit down to eat. And the added benefit is that you will have another meal ready to go for the next day. Got another question for you to think about. Did you know that it's okay not to eat everything on your plate? Or that it's okay to leave food on your plate? Were you brought up that way? And I understand why this is so hard for people. We hate to waste food. It started probably during, the Depression. There wasn't always food available. People really didn't like to waste food. However, I read something once that really had an impact on me. It said, if you eat everything on your plate, just because you do not want to throw it away, you are using your body as a garbage can. That extra food won't hurt the garbage can, but it can hurt your health. Okay. Of course, a great alternative would be to pack it up and save it for another meal. But if there's not enough to save, it's okay to throw it away. Your health is the most important thing. And that's why I picked this picture, because when I saw it, I was thinking, yeah, it's at that point where you might feel you're full, you're satisfied, you had enough to eat, but it's not enough to save or to take home if it was a restaurant. And that's when you really want to throw it away. Okay. And at restaurants, it's really important to keep this in mind, and you can often get 2 meals or more out of one serving. So she's just saying, I wish I could lose weight as easy as I lose my keys, pen, cell phone, my temper, and even my mind. Okay. We talked about how weight gain can be a contributing factor to developing insulin resistance, which is often the first step towards prediabetes or type 2 diabetes. And it's not easy to lose weight, especially as we get older. So a goal for some people might even be to try not to gain more weight, or to aim for a nice, slow and gradual weight loss, using the mindful strategies that we talked about. And as Dr. Gillis Funderburk showed in her slides too, was that you don't even have to lose a real large amount of weight to have benefit. And she showed you the plate method. The plate method is by far my favorite method for teaching people healthy eating. I always say keep nutrition simple. So this really just helps when you're planning meals and how to arrange the food on the plate. And I really think that this is a great visual for people with diabetes as well as those who do not have diabetes. It really is just a guide to healthy nutrition. So looking at the slide again, half the plate, you notice, is filled with those non-starchy vegetables. Okay, and then a quarter of the plate is where we should aim to put the carbohydrate foods, because those are the foods that have the largest effect on our blood glucose. And the other quarter of the plate would be our protein foods. So we're getting a good variety of nutrients on the plate. And I wanted to show you, because I just think that pictures are the best way to show. So these are some more examples of how to use the plate method. So all these examples include some protein, whether it's salmon, here there's some hummus, here there's some meat, some taco meat. They all contain some carbs, whether it's brown rice or a whole grain. This just looks like we'll say it's some whole grain tortilla chips, or some tortillas, and then to load up your plate with those non-starchy vegetables. The non-starchy vegetables are low in carbs, low in calories, loaded with nutrients. Some additional plate method examples. There are just so many combinations to come up with. If you just keep the plate method in mind when you're planning meals and putting the food on your plate. I really think that just this method alone, most people with prediabetes or type 2 diabetes will be able to manage their blood glucose levels. And here's some examples with what we might consider lunch type meals, although you can eat these foods for dinner. And of course you can eat dinner type foods for lunch. Hey, you know, if you want to eat breakfast type foods for dinner, that's fine too. I think it's just good to try to include some protein and a carb food and lots of vegetables. So these are kind of like deconstructed meals. If you wanted to have a sandwich, you might have some tuna on some whole grain bread and have a salad on the side, or you might have a shrimp salad with, nice shrimp and garbanzo beans. There's some cheese and crackers and some spinach, baby spinach. So make, lots of combinations, make some easy meal ideas. And I want to, of course, look at some breakfast ideas. The key to breakfast also is to combine some high fiber carbs with some protein. This combo really keeps your blood sugar from spiking and will help keep your energy more sustained through the morning instead of that spike and crash effect that you might experience when you have those simple carbs like pastries and muffins and donuts or white toast or a whole bagel, because those foods are very high in carbs, and if you're not having protein with it, you can really have those spikes and then you get hungry soon after. So choose some high fiber carbs like oatmeal or another high fiber cereal, whole grain toast, English muffins, whole grain. They have the whole grain light English muffins are a good choice. Waffles, which also come in whole grain varieties. Good protein choices for the morning would be peanut butter or other nut butters or nuts, such as pecans, almonds, or walnuts. They add some healthy fat and protein to keep you feeling full longer. Eggs are another morning protein that can be prepared in a variety of ways. You can make some hard-boiled eggs to keep in the fridge to grab in the morning, or make eggs in a mug. That's one of my favorite things to do. I do it all the time. I just put the egg in the mug, make sure you beat it up well if you want to add a little bit of shredded cheese in it, and I put it in the microwave, usually for 30 seconds, another quick mix. Might put a little bit more cheese on top and then put in the microwave for about 20 seconds. And I find it really comes out well, but test out your own microwave. You can even add a little leftover vegetables to it to add some vegetables in the morning, and then have it with a slice or two of whole grain toast or a multigrain light English muffin. And people often skip breakfast because they're in a rush in the morning. So try to keep it simple with some of these ideas. So far, we talked about how carbs affect your blood glucose, how reducing portion sizes may be helpful, and the plate method for meal planning. So let's talk a little more about what should we aim to put on the plate. So really the goal is aim to eat a variety of foods. Try to eat a lot of plant-based foods. This doesn't mean you need to become a vegetarian. It just means to include lots of plant-based foods throughout the day, such as vegetables, fruits, whole grains, nuts, and beans. These foods provide fiber, vitamins, antioxidants, and potassium. They contain nutrients also that help to lower cholesterol, your blood pressure, as well as reduce your risk of certain types of cancer. They can even decrease inflammation in the body, which is the cause of many health issues. So that's the key, is lots of variety with your whole grains, lots of color. I think that's what this slide really shows, that you want to include lots of color in your meals. Lean protein choices can be chicken, turkey, fish, lean beef, beans, eggs, and tofu. These foods will help you feel full longer, and they really don't affect your blood glucose much. Aim for about a 3 to 4 ounce portion of your protein foods. That's generally 3 ounces is about the size of a deck of cards, or a little larger than that is a good portion size. And again, this really does vary on the person, their age, how active they are, and what their blood glucose levels are as well. But aim to include whole grains, which tend to have less of an effect on your blood glucose. So look for things like quinoa, oatmeal. Try to stick with the old-fashioned or the steel cut. They're less processed, so they don't give up their starch or their glucose molecules as quickly, so they won't raise your blood sugar as much. Brown rice, whole grain pasta, there's whole grain couscous now, and other whole grain breads and cereals. And just remember to watch the portion sizes of these foods. Include beans and lentils often, pinto, black, kidney, garbanzo. They're high in protein and soluble fiber, which has that added benefit of lowering blood glucose levels. And they tend not to raise blood glucose as much as other carbs. So add them to soups, salad, rice, tacos, chili, Add lots of vegetables with them too. Include lots of non-starchy vegetables. One of my favorite ways to prepare fresh vegetables is to roast them. Just put them on a pan, drizzle with a little oil, and put them in a hot oven, like 400 to 425 degrees for 20 to 30 minutes. Flip them over at the halfway point and just roast until they get a little browned, a little caramelized. You could add whatever seasonings you like. Cooking vegetables in ways that are more enjoyable will likely make it easier to fill up half your plate with them. You can use fresh or even frozen vegetables for sauteing. That's another way I enjoy cooking vegetables. You can even take frozen vegetables, and frozen vegetables are just as healthy as fresh. Even canned vegetables can be a very quick way to add vegetables to your plates. Just drain them or rinse them to get off the liquid if they're packed with salt. Microwaving them or steaming them are also healthy ways to cook vegetables as well. Just be careful that you're not adding lots of butter and lots of excess cheese and things like that to make them flavorful. Salads are another great way to add more vegetables. Try including a variety of healthy ingredients such as vegetables. You can add fruits to salads, nuts, beans, avocado. If you add some protein such as chicken, tuna, or a hard-boiled egg can really make your salad into a meal. Olive and canola oils are good choices and also help to lower your blood cholesterol levels. They're great to use for roasting and sauteing vegetables and for salad dressings. Those are the healthy fats that lower your bad cholesterol but don't lower your good cholesterol. Okay. I wanted to talk a little bit about some guidelines for meal timing. Some people are not hungry when they first get up, and that's okay, but generally you should try to eat something within 1 to 3 hours of waking. When people skip breakfast or other meals during the day, they tend to get very hungry, and then they're likely to eat quicker and eat larger portions when they finally eat, which can then raise blood glucose. Remember, just a large portion at one time going to your stomach will likely make blood glucose levels go up. So you're better off having smaller amounts and spreading them throughout the day. Okay, people that skip meals earlier in the day too tend to eat more in the evening. So plan out your meals so that you don't go more than 4 to 5 hours without eating. And if there is a longer time between your meals, because sometimes life that's the way it goes between work or errands and doctor's visits. So plan for a snack. You might bring something with you or plan ahead if that's needed. Which will lead us to talk about snacking. When you're looking for something to eat, first just ask yourself, am I hungry? If you are hungry, I think it's important to listen to our body and eat. If you're not hungry, then you can ask yourself, why am I looking for something to eat if I'm not hungry? Am I bored? Am I stressed? Am I lonely? Is it a habit? There are many non-hunger reasons why people eat. So I want you to get in the habit of trying to choose other activities to do at that time. You might like to read, listen to music, try a breathing technique, do some chair yoga, a craft, go for a walk, call a friend. Try to come up with other stress-reducing activities to do when you're not hungry. You might even create a little list after we finish this presentation of other things that you can do, and keep it handy, because sometimes, when we're in that moment, we just automatically, it's a habit, we reach for food. So if you can take a few minutes and maybe do some deep breathing and think about why you're looking for food, or if there's something else you can do, I think that's just a great strategy. We need to find other activities and coping strategies instead of food and alcohol, which both have increased during this pandemic. Snacks can be an area where we eat a lot of carbs and high sugar foods such as cakes, cookies, and candy. I think we often grab easy snacks, in the moment of hunger, such as chips and cookies. So I want you to try planning your snacks ahead of time. Keep some of these items around and ready to go. I think that's the key. If you have them around, if they're ready, if they're cut, they're washed, you're more likely to grab them when you want something to eat. So think about your vegetables, maybe have them with a little hummus. Fruits, I like to sprinkle just a little bit of granola on berries, or put a little squirt of whipped cream even on some strawberries or blueberries. Nuts, a small handful would be a great snack. Some of these, you can have in combination with each other. Peanut butter and fruit is a great combination, a little bit of peanut butter on apple or half of a banana. Low-fat cheese, a low-fat cheese stick is also a handy snack, and it's easy to take with you. 3 graham crackers, yogurt, popcorn are all good choices. And I always say compromise. You know, sometimes if I really want the tortilla chips, I might take a small handful of tortilla chips with some raw vegetables and a little hummus or salsa. When you eat them together, you tend to eat less of the high carb tortilla chips and you're getting some healthy vegetables in too. And really, they say the average American gets half the recommended amounts of fruits and vegetables. So I think snacks are a great area to try to include those foods. Portion snacks, I think that's really the key. You know, use small containers or bags. Avoid sitting down with a whole box or a whole bag of snacks. We've all been there when you have that bag of chips or cookies and it's right in front of you. It's just so easy to keep going. And then you look down, you're like, wow, where did it go? Did I really just eat all that? So to not get stuck in that situation, yeah, put it in a bowl, put the bag away, and then practice your mindful eating, eating slowly. And portioning snacks ahead of time will also prevent overeating. As far as our beverages, you really want to aim for those sugar-free drink choices. Water is a great choice. I always say that's on the top of my list of things for people to drink when they're trying to prevent diabetes or they have diabetes, because a lot of beverages can have a lot of sugar. Seltzer water is great. It comes in many different flavors. Tea, coffee, low-fat milk. Ideally, choose drinks that are unsweetened or with a sugar substitute. And keep in mind that a whole piece of fruit is a better choice than juice. Juice has a lot of natural sugar, but it's already in the liquid form and it goes very quickly to your stomach and gets absorbed into your bloodstream and can really make blood sugars rise. So choose your sugar-free drinks. So this just shows how much sugar is in one 12-ounce can of soda, and it's actually equal to 10 teaspoons of sugar. 10 teaspoons of sugar is a lot. It's actually equal to about 40 grams of carbs. There are 4 grams of carbs in each teaspoon of sugar. And that's a lot of sugar. So I think most of us wouldn't just sit down and eat 10 teaspoons of sugar at one time, but if we're drinking a regular soda, that's how much sugar we're actually consuming in that portion. Okay. So how much carbs should you aim to eat at a meal? The amount of carbohydrate that is recommended really is very individual. It depends on your height, your weight, your age, your activity level, your weight loss goals, and your blood glucose numbers. For those, though, that want more specifics, a good starting point may be for women, aim for about 30 to 45 grams of carbs per meal. For men, aim between 45 and 60 grams of carbs per meal. The plate method usually does take care of this goal. And I have all different responses from people. Some people say, oh, wow, you know, that sounds like a lot. And then there's other people that say, that doesn't sound like anything at all. And I always say, you know, start where you are. And I also do think that the best way to really know if it is the right amount of carbs for you and if your body can handle it is if, I know that people with prediabetes are not going to be checking their blood sugar, but people with diabetes, if they have a meter and they do check their blood sugar, they can really get a good idea of how different food portions affect their blood glucose. I tend to recommend going for the lower numbers. So for women, you might aim to have 30 grams of carbs at the meal and then save 15 grams of carbs or so if you need it for a snack. I think it's often helpful. And again, you know, we're not trying to be exact here, but I think this is just good ranges to start. And again, depending on your activity level. So let's look at a food label. When we're looking at the food label, first look at the serving size. Okay, that's the very first thing to always look at because the information that follows is based on that serving size. So in this example, the serving size is 2/3 of a cup. Okay, and then you're going to scroll down and you're going to find where it says total carbohydrate. And you see how that's in a bold print. Okay, and we're going to focus on the grams of carbohydrate right next to that. Okay, not the percentages. Don't worry about that. Focus on the grams of total carbohydrate. And notice also that underneath total carbohydrate, it lists dietary fiber and also total sugars and includes the added sugars. And you can see how it's actually a lighter print and it's indented a little bit. Okay, and that's because they are included in that total carbohydrate. And once that total carbohydrate goes to your stomach and is digested, it's broken down into sugar. So that's why we focus on the total carbohydrate. Okay, so I want to just give a couple examples. These are examples that I took from regular products, and this is from a label of bread. And if we looked at the label, it said that the serving size was 1 slice and the total carbohydrate was 15 grams. So 1 slice of bread, 1 slice of this bread contains 15 grams of carbohydrate. So I want you just to think about how many grams of carbohydrates would be in 2 slices of bread. Okay, right? If 1 slice had 15 grams of carbs, then 2 slices would have 30 grams of carbs. You would just double the total carbs because we doubled the serving size. Okay, so these are just things you can kind of practice when you're looking at the food labels at home. And you can see how things can add up pretty quickly. Here, say you had a box of cookies and it said that the serving size was 4 cookies. Okay, and the total carbohydrate was 30 grams. How many cookies can you eat if you want to eat 15 grams of carbohydrate for a snack? So again, if you have 4 cookies, if 4 cookies have 30 grams of carbs, then 2 cookies would have 15 grams of carbs. Okay, and what I would suggest is put the 2 cookies on a plate and then put the bag away and then eat them on your plate very slowly. And what I always say too, because people sometimes say cookies, you know, and we talked about lots of great snack ideas, but I think that most people are going to have a treat once in a while, and I want you to learn how to do it so you don't feel guilty. I don't want anyone to feel guilty about what they're eating, but that you watch the portions, I think really is the key. We want to consume healthy foods, most of the time. That's the goal. And Dr. Gillis actually did a great job of going over some physical activity, but just to, keep in mind that physical activity has many benefits. I know a lot of people think that the main benefit is weight loss, but as she explained, and I agree, it doesn't burn huge amount of calories or help that much with weight loss, but it sure does improve blood glucose levels. It lowers blood pressure. It can improve your cholesterol. It makes your heart a stronger muscle because your heart is a muscle, as well as your other muscles in your body. It can improve your immune function. It can reduce psychological stress, and I think a lot of us are under stress. Mood enhancement, and just you get a more restful night's sleep. So doesn't that sound good, right? So the real challenge, I think, is just to fit it into our day. It's just to get it done. So like she said, the goal is 150 minutes per week, which can be broken down into 30 minutes per day, 5 days a week. But you can also break up that 30 minutes. You might say it's easier for me to do 2 15-minute sessions or 3 10-minute sessions. That's fine. I always say start off, just saying, let me go for 10 minutes, a day. Start small. In a perfect world, we would all hit the recommended amount of physical activity, but we all know that nothing is perfect, and definitely not as far as our eating and activity. So just start off and try to stick to it. I think we're more likely to stick with a goal if it's doable. So plan a goal that's doable for you and just try to get moving. And I do think even just during your day to get more steps, you've heard them before, park further from the entrance, use stairs instead of an elevator. When going to the bathroom, take a walk around. That's something that I do at work. I'm already getting up and I'll go to maybe the furthest bathroom. At home even, I'll go to the upstairs, bathroom. Try to just get in a little bit more activity into your day. While you're watching TV or cooking, you might even march in place, take a few laps around your house. Just aim for sitting less and moving more. You might say, I'm going to take a walk either before lunch or after lunch. Sometimes if we associate a goal with another activity, we're more likely to do it. Once it becomes a habit, you just know, okay, it's lunchtime. Okay, I'm going to take a walk now. You may even be when you're, if you're talking on the phone, walk around your home, walk your dog if you have a dog. All those, every step counts. Some people find it helpful to wear a device that counts the number of steps they take each day. It can encourage you to walk more. You've probably heard about the goal of 10,000 steps a day. So whatever motivates you, if you find that helps, because it's a challenge to try to get in, and again, I would say too, don't start off saying I need to get 10,000 steps if you're used to getting 2,000 steps a day, to gradually work your way up, if that's a helpful strategy for you. So really what I want you to do today, I want these sessions to be useful to you. So you really can think about some areas that you'd like to work on. So I want you to think about your eating behaviors. Do you eat quickly? Do you skip meals? Do you want to focus on your meal choices, snack choices, or beverage choices? Are your portion sizes large, or are you eating too many carbs or sweets? Do you eat when you're stressed or bored? Can you add more physical activity into your day? And then choose 1 or 2 goals to focus on. I really think it's important to make changes gradually. Change happens 1 step at a time. And one thing I also like to add is that it's just so important, probably the most important thing is to speak kindly to yourself. Talk to yourself with self-compassion. Self-compassion is not natural for most of us. You really have to practice it. So if you fall off track, I don't want you to be so hard on yourself or to use negative words towards yourself, because really that is not motivating. So try this time to use a kinder approach. Talk to yourself the way you would talk to a close friend. We tend to fixate on what didn't go well, but I want you to try to take a more balanced view of the situation. There's always going to be struggles. We all have struggles, and try to just focus on one thing at a time, and remember that small steps can really make a big difference. So I want to thank you so much for taking the time to come to our presentation tonight. I want everyone to stay well and safe, and please join us for our other diabetes programs. I do a monthly Speak with the Dietitian class on Zoom, and we also have a more comprehensive class for people that have a diagnosis with diabetes. You just need a physician referral for that one. So you can contact Capitol Health's community education website or the diabetes education program for more information. I can give you that number as well. It's 609-537-7081 to sign up or register for our diabetes programs. And I also do individual nutrition sessions via telehealth with a physician referral for people that might want a little one-on-one in-depth education. So with that, I guess we can open it up to questions.
Okay, so we have a few questions in the chat box. We can only do a few tonight because of time. So the first question is, could you touch on the dawn phenomena?
Okay. Hi. Yes. So dawn phenomenon is basically when people have diabetes, that basically overnight, often between like the hours of 2 to 4 o'clock, sometimes going even a little bit earlier in the morning or later in the morning. There's hormones that can increase the resistance of insulin. So there's hormones, cortisol, growth hormone, adrenaline, that all have the effect of causing more insulin resistance. And then the sugars, because of that, end up going up. And so some people will go to bed and their sugars are, 100, and then they wake up and it's 140. And I often get the question like, oh, I didn't even eat anything. And, why did my sugar go up, overnight? And it is because of these counter-regulatory hormones to insulin that increase insulin resistance. And then sometimes the liver itself, because of increase in a hormone called glucagon, will start putting out more glucose overnight as well.
Thank you. Another question, do you ever recommend that someone with prediabetes, A1C of 6, start taking a medicine?
Yes, so there's no medications that are approved for prediabetes, but we do often prescribe medications, typically something like metformin, and then there are newer medications called GLP-1 excuse me, agonists that we sometimes prescribe, especially if someone's overweight. Excuse me. And we know that they have insulin resistance and the weight loss that can happen with these specific medications, again, called GLP, can be helpful in reversing prediabetes. And then with metformin, we know that in addition to diet and exercise, that can also help reverse for prediabetes to diabetes as well.
If someone is anemic, does that affect the accuracy of the A1C reading?
Yes, that's a great question. So that's why I did want to say caveat, because there are several confounding factors that make A1C not necessarily accurate. And being anemic definitely is one. Acute blood loss, iron supplementation can cause A1C to look better than it actually is. So if someone's hemoglobin is low, then there's less hemoglobin for glucose to bind to, and so that the A1C is going to be lower. And in certain conditions can cause increased affinity to the hemoglobin to binding glucose, so it might be inaccurately elevated as well.
Okay, thank you. Another one is, I read that frequent snacking/eating can have an adverse effect on spiking insulin and managing diabetes. What do you think about this?
So I'll let Mindy answer it as well. But as far as for frequent snacking, so, one, it depends on what you're snacking on. So if you're having, snacks that consist of things like cheese or nuts, that's very minimal sugar, you're really not going to get a sugar spike. But definitely if snacking on, carbs, especially processed types of carbs, even if they're small amounts, they're going to add up over time because, even though, again, they're small amounts, the body kind of continuing to be able to process those carbs is going to be difficult. But definitely if you're doing smaller, more frequent meals and they are limited in as far as processed carbs and just limited overall in the portion of carbs, that actually is a good way to manage the glucose, because you're not putting in a whole bunch of carbs all at the same time.
Yes, yeah, no, what you said is very, very good, Dr. Gillis. And, and I think it's also just important to think about, why are you snacking frequently? I do think it's so important to pay attention to our body and to make sure that you're not eating when you're not hungry, because that can definitely affect, your blood glucose too. So I think generally a good spacing of meals for a lot of people, although it does depend on what you ate. If you had more protein at a meal, you're probably not going to get hungry as soon. So then when you do have a snack, I think those are great choices. Nuts, a cheese stick, some peanut butter, and small amounts of carbs would be good choices. Generally, if you can go at least 3 or 4 hours between meals, I think that that's helpful for just giving you a little bit of a chance for the blood sugar after the meal to go back down before you're adding more carbs into your system.
And the next one is, Mindy, will you lose weight eating 30 carbs a meal? I have the ADA cookbook, and most of their meals are 30 to 40 carbs. That seems like a lot to me.
I definitely think you can. It really depends on what you eat overall. And as you know, because there's so many different diets out there, and when I say diets, usually they are things that tend to be, strict, and they end up being temporary. So I think that, we're so used to hearing people lately talking about keto, which really, if it's done right, is a very high fat, and it has protein, moderate protein, and very, very low carbs. And when people go on diets like that, they lose weight very quickly, but they're losing a lot of water, because carbs hold water in our body. So when they cut out those carbs, they really lose the water. But it's the fat stores that we want to lose. So I think if you're choosing whole grain carbs, and you're just still watching the portions, because 30 grams of carbs really is not that much. If you think about 1/3 of a cup of cooked rice or quinoa or pasta is equal to 15 grams of carbs. So 2/3 of a cup of pasta or rice or quinoa is 30 grams of carbs, which really is, just the amount that fits right nicely in the quarter, of your plate. And I really think that, if you're following that and limiting to, about 30 grams of carbs at the meal, and you're not overdoing your portions of your protein, and you're having lots of vegetables, sure, I think that you can lose weight on that.
And the last question we have is, Mindy, could you touch on a glass of red dry wine at dinner time?
And I always say too, first, always just double check with your physician, because sometimes people are on certain medications or have other health issues where they might not, it might not be recommended to drink wine. If you have liver disease, if you have a history of alcohol abuse, of course, if you're pregnant, are all reasons why you would not want to do that. But a little bit of wine can be, you know, it can be nice, if I put it that way. Remember that a glass of wine or a serving of wine is equal to 5 ounces. And a lot of times our glasses can be a lot larger than that. And the recommendation by the American Diabetes Association, Heart Association, really is for women no more than 1 drink per day, and for men no more than 2 drinks per day. And there's other groups that will say, probably it's best only to have it, you know, a few times a week. You know, I always say it's pick your disease. They think it might be good for lowering blood pressure, but then they think it also might increase our risk of certain types of cancer, such as breast cancer or colon cancer. So I always say moderation. If you have it, enjoy it, sip it slowly, and just watch your portion sizes, and just double check with your doctor. It does have some antioxidants, the red wine, right? So that's good for its anti-inflammatory properties.
Okay. Thank you so much for this presentation this evening, ladies. I put the evaluation link in the chat box, so please fill them out. If you have any questions, I'm going to stay on a little longer, just in case. And again, thank you for joining us tonight.